Welcome to my YouTube channel Voxo Health and Pharma. If you are new in my YouTube channel, please subscribe my channel and press the bell icon. Today I will discuss about Parkinson's disease. The topic of today I will discuss 1. What is Parkinson's disease? 2. Type of Parkinson's disease. 3. Etiology of Parkinson's disease. 4. Sign and symptoms of Parkinson's disease. 5. Complications of Parkinson's disease. 6. Diagnosis of Parkinson's disease. 7. Plan of treatment of Parkinson's disease. What is Parkinson's disease? A slowly progressive and degenerative disease affecting the nervous system is termed Parkinson's disease. Named after its pioneer, James Parkinson in 1817. Parkinson disease results from an insufficiency of dopamine in the brain, and is thus categorized as a movement disorder. According to the WHO, a severe progressive neurodegenerative disorder of deciduous onset, which is controlled primarily by the presence of motor symptomatology, bradykinesia, rest trembling, stiffness, and posture disturbances, is called Parkinson's disease. Next, type of Parkinson's disease. Parkinson's disease is of the following two types. 1. On the basis of etiology. 2. On the basis of age of onset. Let's discuss about on the basis of etiology. The basis of etiology is again classified into two parts. 1. Primary Parkinson's disease. 2. Secondary Parkinson's disease. 1. Primary Parkinson's disease. This type affects individuals after 40 years of age and is more prevalent in males. 2. Secondary Parkinson's disease. This type is essentially Parkinsonism, and results from causes other than the Parkinson's disease itself. 2. On the basis of age of onset. The basis of age of onset is again classified into two parts. 1. Early onset Parkinson's disease. 2. Late onset Parkinson's disease. 1. Early onset Parkinson's disease. This type affects individuals before 40 years of age, and is further classified into 1. Young onset Parkinson's disease. This begins between 21 and 40 years of age. 2. Juvenile Parkinson's disease. This begins before the age of 20 years. 2. Late onset Parkinson's disease. This type affects individuals after the age of 40 years. Next, etiology of Parkinson's disease. 1. Genetic factors. Though the exact gene responsible for the disease has not yet been identified, the role of genetic factors has been implicated. Mutations in genes result in the occurrence of the disease. 2. Environmental factors. Factors like age, sex, dietary habits, infections. Environmental toxins like heavy metals and well water are some of the environmental factors stimulating the occurrence of PD. 3. Other factors. Some secondary factors include head trauma, infections most commonly by influenza virus, such as post-encephalitic Parkinsonism, neoplasms, atherosclerosis, exposure to toxins, and drugs like neuroleptics, antiemetic, and hypertensives. Next, sign and symptoms of Parkinson's disease. Mainly the symptoms divided into two parts. 1. Motor sign and symptoms. 2. Non-motor sign and symptoms. 1. Motor sign and symptoms. Resting tremors, bradykinesia, muscle rigidity, postural instability, loss of automatic movements, blinking, smiling, and swinging her arms while walking. Freezing, difficulty in taking the first step. Micrographia, the size of handwriting gets smaller over time. Hypomimia, mask-like expression. Unwanted accelerations, suddenly rapid speech, or an uncontrolled acceleration in walking, known as festination. Parkinsonian gait, a common way of walking stooped over, with AF combination of freezing and festination. Difficulties with speech, soft voice or slurring of words. Difficulty in swallowing, drooling and increased risk of choking, and trisexual dysfunction. 2. Non-motor sign and symptoms. Restless leg syndromes, RLS. Loss of sense of smell. Pain, mood and sleep disorders, memory disturbances and dementia, in later stages. Respiratory dysfunction, depression. Next, complications of Parkinson's disease. 1. Anxiety and depression. 2. Difficulty swallowing. 3. Madness, example of madness. Memory loss, trouble concentrating, bad decision, hallucinations, seeing things that are not real. Confusion, false thoughts, irritability, sleep disturbances, anxiety. 4. Sleep disorders. 5. Bladder and bowel problems, like frequent urge to urinate, incontinence or overactive bladder urge. When you laugh, exercise, or sneeze, stress incontinence. Need to urinate frequently at night. weak urine stream. Making some lifestyle changes can improve bowel and bladder issues, for example. Go to the bathroom at regular times throughout the day. Increase your fiber and fluid intake. Take a stool softener. 6. Involuntary movements. 7. Fatigue. 8. Pain. 9. Blood pressure swings. To avoid a sudden drop in blood pressure, drink 8 glasses of water every day. Excess fluid increases blood pressure. Ask your doctor if you need to adjust the dose of any medication that may affect your blood pressure. 10. Decreased sex drive. 11. General immobility. Diagnosis of Parkinson's disease. Diagnosis of PD involves main 2 funda. 1. Physical examination. 2. Imaging. 1. Physical examination. This includes proper assessment of the characteristic signs and symptoms including tremors, rigidity, bradykinesia, and postural instability along with familial history. 2. Imaging. This excludes the other possibilities of neurological dysfunction like vascular causes and includes CT scan or MRI. These tests are used to study signs of a stroke or brain tumor. Sometimes the results of Parkinson patients appear normal. Positron emission tomography. It is used to assess activity and function of brain regions involved in movement. PET is a highly specialized imaging technique, in which radioactive substances are used to create 3D colored images of chemical substances functioning in the body. Information about the chemistry of body can be studied through a PET scan. In PD patients, this imaging test is used to detect low levels of dopamine in the brain. Single proton emission computed tomography. Its principle is almost similar to that of PET and is used in the diagnosis of neurodegenerative disorders. Next, plan of treatment of Parkinson's disease. Treatment of Parkinson's disease involve 1. Non-pharmacological approach. 2. Pharmacological approach. 3. Surgical approach. 1. Non-pharmacological approach. This involves inclusion of physical therapy such partial weight-supported treadmill gait training, PWSTT, and while vibratory feedback system in routine life that may help improve daily activities as well as maintain the gait. 2. Pharmacological approach. In this involve 1. Drugs acting on dopaminergic system. This group of drug includes dopamine precursor. This class includes levodopa, 1-dopa, which reaches the brain and converts into dopamine, thus restoring dopamine in the substantia nigra and striatum to normal levels. Peripheral decarboxylase inhibitors. These include carbidopa and benserazide. These drugs have an added advantage of decreasing the incidence of nausea and vomiting, as they block the conversion of levodopa to dopamine in intestine and blood. Administration of these drugs thus makes sure that levodopa, in more amounts, enters the brain and is not lost by its conversion in blood or intestine. Dopaminergic agonists. These include synthetically derived compounds like bromocriptine, ropinirole, and pramipexole that imitate the action of dopamine at the dopamine receptor, the message receiver, in the striatum, though they are not as potent as levodopa, and administered along with it. MAOB inhibitors. These include selagiline and rasagiline, which act by increasing and lengthening the effect of every single dopamine molecule. They achieve this by interfering with one of the enzymes that break down dopamine, monoamine oxidase, or MAO-B. COMT inhibitors. These include entacapone and tolcapone, which act together with levodopa preparations so that its breakdown in intestine can be prevented. These agents block the COMT enzyme and help levodopa reach the brain in more amounts, resulting in its conversion into dopamine, thereby attaining a better control of the signs and symptoms of Parkinson's disease. Dopamine facilitator. This includes amantadine that exerts its action in 3 different ways, including an anticholinergic activity, releasing dopamine, and by influencing the excitatory neurotransmitters in basal ganglia, thus relieving the symptoms of Parkinson's disease. 2. Drugs acting on cholinergic system in the brain. This group of drug includes central anticholinergics. These include trihexyphenidyl, benzhexol, procyclidine, and biparidine, which does not directly act on the dopamine system. Their mode of action involves blocking the outcome of a different neurotransmitter. They are only effective against tremors and are commonly used in younger patients in whom tremors are levodopa. Antihistaminics. These include orphenadrine and promethazine, which act by modifying the serotonin histamine system. 3. Surgical approach. This approach is performed stereotactically. Target cells in brain are reached with the help of a computerized guidance system through a small hole made in the skull. The target cells are either destroyed or are electrically stimulated using a needle and are commonly referred to as deep brain stimulation, DBS. The three main targets of destructive and stimulation therapies include 1. Subthalamic nucleus station stimulation. 2. Thalamotomy, destroying a small group of cells in thalamus, and 3. Pallidotomy, destroying a group of cells in internal globus pallidus, the major area from which information leaves the basal ganglia. Thank you for watching this video. If you need more information about Parkinson's disease and for the PPT, please visit our website. Link in description. Follow me on Instagram, link in description.